Can you hear me, Mr. Mike?
I can hear you. Hey there, how you
All right,
doing?
Hey, doing good. How about you, sir?
Not too bad, thank you. Hey Esperanza, hey Lexi.
Hello.
All right, I'm gonna go ahead and get started. Do you guys all have a good weekend?
Yeah, I
Yes, sir.
think
How
that
about
was.
yourself?
Good. Yeah, it was not too bad. They're always short though, aren't they? You guys ready for Christmas?
Yes, sir. Ready for that 2 week?
Right on. All right, so I wanted to talk about the bones of the cranium and the face today. So give me a second. I'm just going to share my screen with you guys. Okay, can you guys see that okay?
Yeah.
All right. So it's going to be a little bit of a shorter Zoom session today, but I wanted to make sure that I went over the bones of the cranium and the face today. But first, I just wanted to kind of touch on the landmarks of the face. If you have your book with you, that would be great because I want to have you kind of follow along with me. This is on chapter 7, which starts on page 113. Which is where a picture of this lady can be found. And it just goes over the landmarks of her face. So just kind of going over the first one here, the ala of the nose, and some of these don't exactly point exactly to where they're supposed to, so I'll correct it as we kind of go through them. But the ala of the nose is just this kind of swoopy part of the nose that kind of curves in and out like that. That's the ala of the nose. And if you kind of go down the ala and go down this way, we run into the nasolabial groove. That nasolabial groove, which is what this thing kind of points to, is this kind of groove that we see here. Sometimes as we get older, we see this little wrinkle here that kind of goes down this way when we smile. That's the nasolabial groove. And then just kind of continuing on, next we have the vermilion zone. The vermilion zone is just the red part of the lip. We have the vermilion border, which is where that red part of the lip kind of meets the regular skin tone there. That's just the borders of the lips. The next thing we have is a philtrum. And the philtrum is just this little V-shaped indentation right between the nose and the lip. That's the philtrum. And then we have the, the vermilion, or we went over that. The labial commissure. The commissures are just the corners of the lips here. And I know it's pointing there, but it really should be pointing here to the corners of the lips. These are things that we want to look for as a dental assistant to make sure that we don't see like any cracking. So the commissure, sometimes we can see cracking and chafing there. So that's something that we kind of want to point out. A lot of the times it's a sign that the patient is dehydrated or maybe malnourished a little bit. And so what we want to make sure is if we see any cracking there, offer the patient some Vaseline, because a lot of times we're going to be stretching the lip around those corners there, which can be pretty uncomfortable. Let's see, the labial tubercle. Let's see that thing. Give me 1 second here. Oh, there it is. So that's just a small projection that like sometimes enlarges or thickens right around this area. that's sort of on the side of the philtrum here. Okay, so I'm just going to jump over to the landmarks of the hard palate. So in your book, this can be found on page 115. And so the incisive papilla, that is this little indentation or this little kind of extra tissue here. The incisive papilla also is kind of like a marker of where that incisive foramen is. If you remember, and especially in radiography, for those of you who took radiography, that's that opening right on the inside of the anterior of the centrals. That's where we have blood vessels and nerve endings that kind of go through that hole. The palatine raphe, this is this white line that kind of goes up and down here. The rugae or the palatine rugae are these little bumpy things right at the top or the roof of your mouth that you can probably feel if you run your tongue up there. Kind of bumpy things here. I used to think that they were that those weren't supposed to be there at one time, and I remember going to my dentist as a kid and thinking, oh, I have something growing there, and they're like, no, that's supposed to be there. So those are those palatine rugae that are there. Sometimes people have what we call torus or tori for plural, and they're these little bony overgrowths. Sometimes they're on the roof of the mouth. More commonly, they can be found on the mandible, right in between, or right underneath the tongue. Sometimes those can be painful if you happen to have those, and getting X-rays, they can cause extra discomfort when getting X-rays. So those are things that you want to also be aware of. So just going over, let me see, this is just, so the uvula is just that little dangly thing on the back of your throat that you can sometimes see if you open your mouth really wide. The palatine tonsils are these little, they're almost like little donut shaped discs on the back of your throat. Sometimes they can be areas that can build up bacteria, and they can cause inflammation. Some people have to have these tonsils removed. And so when you hear of somebody having their tonsils removed, that's just, they have to remove these little discs because they can, like I said, accumulate lots of bacteria over time. The anterior tonsillar pillar is just this kind of opening or this meaty kind of part of the border of the throat here. And again, the palatine raphe is this vertical line that goes up and down. We have our palatine rugae. And of course, again, our incisive papilla is just this little extra skin tag, which can kind of overlap the incisive foramen. All right, so moving along. So these are now the cranial bones that we're going to be talking about. And this starts on page 119 of your textbook. So there are 8 bones in the cranium, and I want to go over each one. First, we have the frontal bone here. And the frontal bone forms the forehead. It forms the base of the occipital bone, which is where the eye sockets, where the eyes kind of sit into. It also forms the part of the nasal cavity, which is kind of indentates here in this area. Next, we have the parietal bone, which forms the upper part of the base of the skull. We have a parietal bone on each side. We happen to see only this patient's right side of their head. And then right below the parietal bone on either side of the head, we have the temporal bone. And the temporal bone forms the lower portion of the base of the skull. And in the temporal bone, there's a few different, I guess, accessories that you should be aware of. First is this external auditory meatus. That's just a little tiny hole it's actually built into the temporal bone. That's where our auditory canal goes through, which is, where we hear from. If we kind of run down in this area here, this is our mastoid process, or the base of it. The mastoid process, by the way, kind of serves as attachments for the muscles of mastication, which are the muscles that we use to chew. And then also built into the temporal bone is this styloid process. The styloid process is this long kind of stylus or pen shaped kind of projection of bone that runs down in the inside of the skull here. The purpose of the styloid process is it just serves as a place for muscle attachment. So when you move your head back and forth like that. Moving on to the, lost my train. Oh yeah. Also in that temporal bone is the glenoid fossa. The glenoid fossa is just this indentation here. And that just serves as where the lower portion of this mandible kind of articulates with that temporal bone. And it's just this kind of depressed indentation. And that's the glenoid fossa. Okay, moving over to the occipital bone. The occipital bone, there's just one of them, and it's at the very back of the head that forms the lower portion of the back or the base of the skull. And moving towards the front here, we have the sphenoid bone. And the sphenoid bone is, it's sort of like a bat shape or butterfly shaped bone. And I'll show you right here. It doesn't really look like a bat shape. This is this area in pink here. But when you're looking at this patient from the front of their face, and looking through their eyeballs, it kind of looks like, I guess, a butterfly or a bat. And I'll show you in a different picture there. The sphenoid bone also, it forms the, it forms also the inside of the eye socket there. And it's hard to see from this angle, but there is another picture here in just a minute that I'll go over a little bit more of what these bones look like and what they do. The sphenoid bone forms the anterior base of the skull behind the orbit and also contains the sphenoid sinuses, which are hollow indentations where, of course, we have our sinuses that are warm and condition the air before they get into our lungs. The ethmoid bone is this, it's hard to see in this picture here, but it's this inside of the eye socket there. And the ethmoid bone forms part of the nose, the orbits, and the floor of the cranium. That bone is thin and spongy or honeycomb shaped. And it also contains the ethmoid sinuses, which are another canals of sinuses that are located inside the nasal cavity. Next, going over the bones of the face, we have their nasal bones. The nasal bone is just this little orange kind of pointy projection on the top. This is this very top of your nose here. And it only kind of goes to about half of your nose. So if you can kind of run your finger down your nose, you can kind of feel this bump or the bridge of the nose. That's where that nasal bone ends. The rest of your nose is just cartilage, basically. Then going down, we have the zygomatic arch. This is a cheekbone that kind of goes in this area here. If we kind of follow up along here, we have our zygomatic process. This is just this kind of vertical piece of bone that runs up towards the eye socket. All right, so now we're looking at the maxilla. The maxilla is, let's see. Does anybody have their book out in front of them?
I do.
Ben, would you mind reading the first couple of sentences of the maxilla on page 118?
Yeah, I can. 118. Okay. The maxilla is the largest of the facial bones and is composed of two sections of bone joined at the median suture. The maxilla extends from the floor of each orbit and the floor and exterior walls of the nasal cavity to form the roof of the mouth. Keep going.
Oh, that's okay right there. Thank you.
You're welcome.
And so the maxilla is kind of, it's that whole upper jaw. And like Ben was saying, it's the biggest facial bone well, it's the biggest of all the facial bones. And it actually has 4 process or outgrowths of bone. The frontal and zygomatic processes, which are kind of this area here. Those meet the frontal and zygomatic bones. And the alveolar process forms a bone that supports the maxillary teeth. And alveolar bone is going to be cancellous bone, so it's a little softer, it's a little spongy. Alveolar bone is found both on the maxilla and the mandible. So if that happens to be on a test, you'll know that it's not just either one, it's for both of them. Okay, next we have the mental foramen. And if you remember, for those of you that took radiography, that mental foramen is that hole on the apex of the lower molars. Sometimes it can be it can be thought erroneously of as an abscess because of the way it looks or the way it's shaped. But it's not an abscess. All it is a little hole on the base of the mandible there, where we have blood vessels and nerve endings that can go through that hole. So moving over to this kind of picture, this is just the same kind of thing. It gives us a different view. Again, that frontal bone is a full forehead. It also serves as the base of the upper part of this occipital bone, as well as the base of the nose, or the upper part of the nose. Here we had that sphenoid bone that I was talking to you about. And if you can kind of look through here, we have this kind of, I don't know, butterfly or bat shaped. It's just the way that that sphenoid bone is shaped. The ethmoid bone is the part of the bone, it's highlighted in that blue or teal color. And then the lacrimal bones are very, very tiny. They're very thin, very fragile bones. The lacrimal bone is where our tear ducts go through. And it serves that purpose to kind of house the opening for our tear ducts. The inferior nasal concha are these kind of like turban looking bones here. They're almost like scroll shaped. We see one here, and then we have another one up there. These are just areas where the sinuses kind of go through and meet. The vomer bone is this very, very small, very thin, fragile bone that kind of goes vertically up and down the nasal cavity here. Here's another picture of the alveolar process. Again, the alveolar process is what houses the bones, the teeth. And then there's an alveolar process on the mandible too, which also houses the teeth. Here's a better picture of the mental foramen. There is one on either side of the mandible here. And the symphysis is just the very tip of the chin. And you can kind of feel the symphysis if you really feel the bottom of your chin here. It's that kind of bony protuberance that pokes out there that way. Let's see. That looks like it for the facial bones. Any questions on any of these so far?
No.
So far, so good. It's a lot, but so far.
Yes, it's a lot. But again, this should be a review for some of us that have taken radiography. And the reason why I'm kind of hitting on it so hard is because, like you kind of know, will be on your RHS exam if you wanted to get your X-ray certification. So these are things that you probably should know, and so that's why we're going over it now. So moving on. So these are the palatine bones. The palatine bones kind of form the roof of the mouth or the floor of the sinus. We have our palatine suture, which is just this little, well, it's actually this line that kind of forms vertically up and down this palatine bone here. And it kind of has, it's actually the place where the two palatine bones fuse together. And then we have our incisive foramen. Again, this is this hole that's kind of on the very roof of the mouth, right, and not anterior, apical of these central anteriors, and it's on the lingual side. Our greater palatine foramen is these things here, so greater palatine foramen, and then our lesser palatine foramen are other little holes that are here. Okay. All right, so now going over to our mandibular bones. Who else has their book with them? Or was it just Ben?
Yeah. I don't have mine with me.
I have mine on me.
Okay, so Elise, do you mind reading for me for the mandible?
For the mandible, it's going to be, the mandible is the only movable bone of the face. The mandible consists of a horseshoe-shaped body that is horizontal with two vertical extensions called rami. At the top of the rami are two projections. The posterior projection is a condyle or condyle process.
Okay. So what he was saying here, we have the horseshoe-shaped mandible here, and then we have the ramus. The ramus is this vertical projection of the mandible, is kind of like a thick piece here, and the rami are these is when the ramus kind of splits up into these two different projections here. The most posterior end of the rami, or the most posterior rami, called the condyle here. And the condyle is where it articulates or attaches to the temporal bone. And the most anterior part of this ramus is called the coronoid process. And then right in between this little notch here is a mandibular or sigmoid notch. And if you kind of go down the ramus, right where the ramus kind of connects to the body of the mandible, we have our mandibular angle. So this is just this little angle here. Just all that is where the ramus connects to the body of the mandible. Now we're looking at the external oblique ridge. So if you kind of look down this line here, that is like a little ridge. And if you were to kind of, if we were in class and I were to pull out that skull, you would be able to see, or you would not be able to see, you'd be able to feel a little projection, a little sharp protuberance here in this area. That is the external oblique ridge. And then we have the border of the mandible, and all that is just the bottom part of the lower jaw. And you can kind of feel that if you run your thumb up and down your chin. The mental protuberance, again, that's just the bony part of your chin where it kind of points out. Going on the lingual side, we have our submandibular fossa. And if you remember, for those of you that took radiography, every time you hear anything called fossa, when we're talking about bones, all that a fossa means is there's like a little indentation. It's not a hole, it's not a ridge, but it's like a little, almost like a little concavity. And a lot of the times it's so subtle that you can't even see it. You have to kind of run your finger across it to feel it. And that's sort of the case with the submandibular fossa. All it is just this kind of like a small, very slight depression here in this area. And then we have the internal oblique ridge. It's also called the mylohyoid line or the mylohyoid process. It's just a ridge that's right above the submandibular fossa. Okay, then we have the mandibular foramen. And again, if you remember foramen, what a foramen means is a hole. Anytime you see the word foramen, that means there's a hole in the bone. So there's a little tiny hole here. You can't see it there, but that is where actually when the dentist goes to inject or do a mandibular block with anesthetic, they'll inject way up here. And there's a little hole, and what their goal is to get that anesthetic to go inside of that hole. And what that does is it numbs that entire nerve that runs inside of this mandible. And it usually comes out the mental foramen. And so what that does is it'll numb all of these teeth in that whole quadrant there. So this is if you're looking at the patient, if you're in front of them and you can see kind of on the outside of them. And this is the same bone. This is as if you're standing on the patient's tongue looking outside of their mouth. Here we have the coronary process here, the condyle, which is that most posterior end of the mandible, our internal oblique ridge. All that is just sort of an angled ridge on the inside of the mandible. And then we have the lingual foramen. And again, the foramen is a hole. So a lingual foramen is a hole right at the tip. It's usually right at the mental protuberance. And around the lingual foramen, we have, it's kind of a dense ring of bone, and that's known as the genial tubercles. Again, the genial tubercles is a dense ring of bone that kind of circles the lingual foramen. Okay, also here's another view of the mylohyoid groove, or also known as part of the internal oblique ridge. It's just a little groove here on the inside part of that mandible. Okay, so that's all the parts of the mandibular bones. Let's see. There's another part that I wanted to show you. I guess that was the only bones that I wanted to show you. I didn't want to go over too many things as far as like the muscles of mastication or even the nerves, because that's just kind of a lot to go over in one Zoom session. But I just wanted to kind of hit on the importance of the mandibular bones. Oh, the one thing I forgot to tell you about the mandibular bones, right behind these most posterior teeth here, we have this kind of triangular shape of bone right back here. That's known as the retromolar area or the retromolar pad. All that is just, it's usually where we have like when we have our thirds taken out, our wisdom teeth taken out, a lot of times there's like a little pad of tissue that's right behind there. And that's all that is just an extra piece of bone that's usually like a horizontal kind of shape that kind of goes flat across. And it's a small, just very triangular shape. Again, that's the retromolar area or retromolar pad. All right, so honestly, that was the only thing that I wanted to kind of really hit on for chapter 7. Does anybody have any questions about anything so far? I'm going to take that as a no. So if you have any questions or if anything comes up, please let me know. Email me. Again, I'm especially like towards the evening, I'm responding to emails within the hour if I can, as long as I'm awake. If I'm not responding within an hour, it's probably because I went to bed, but that's probably not till like midnight or after that. So I'm going to go ahead and leave you guys with that. We'll end a little early today. And if you didn't have any questions, then I will see you guys tomorrow. Tomorrow's Zoom session, I wanted to go over different type of charting called anatomical charting. So we'll hit on that tomorrow. And other than that, if you guys don't have any questions, have a good night. And thanks for joining me.
Thanks, Mike. You too.
Right.
Thank you, Mike. Good night.
All right, good night.
Bye.
Bye.